Hello everyone, my name is Dr. Mallikarjun Kalashetty. I am the head of the Department of Clinical Haematology, Haemato-Oncology, Bone Marrow Transplantation and Cellular Therapy at Manipal Hospital, Old Airport Road, Bangalore. Today I am going to discuss about acute leukemias. We all have heard about blood cancers, and the aggressive forms of blood cancers are called as acute leukemias. There are two types of acute leukemias: acute lymphoblastic leukemia, acute myeloblastic leukemia, and rarely mixed lineage leukemias. Acute leukemias are the cancers arising from the bone marrow, which is an organ which makes the normal blood elements. When patients have acute leukemia, they can have varied manifestations, but most commonly they can have progressive weakness, fever, bleeding manifestations, bone pain, and difficulty in walking around and even carrying out daily routine activities. The diagnosis of acute leukemias is by host of initial blood investigations. However, the diagnosis is often confirmed with a test called as bone marrow examination. This bone marrow examination, once done, a pathologist will look at the cells under microscope to find out morphologically whether they resemble lymphoblasts or myeloblasts. They also run the marrow sample for various special tests called as immunophenotyping or flow cytometry, karyotyping, and also to look at the molecular signature of this acute leukemia to help clinicians target therapy and risk stratify these patients. Most patients of acute leukemia are initially given treatment called as induction treatment to reduce the burden of the disease as early as we can. We have moved from conventional treatment to more targeted therapy in acute leukemia, and several forms of acute leukemia are very well treated with very high success rate. Some of these acute leukemias who have high risk feature or who have suboptimal response to initial treatment, we may consider consolidation treatment with something called as bone marrow transplantation. It is indeed very important to diagnose acute leukemias timely, as delay in diagnosis can lead to complications which can be life-threatening. It is important for us to spread information that those patients who have suspicious symptoms should be evaluated in a timely fashion so that we arrive at a diagnosis early. We here at Manipal Hospital, Old Airport Road, Bangalore, have all facilities under one roof, which help us in not only diagnosing these patients early, but also to treat them well. We also have blood bank services which are very helpful for patients of acute leukemia. I hope this message reaches all of you. Thank you.